On this episode of 26 Minutes with Dr. Warren Siegel, I'm joined by Dr. Keneth Hupart to discuss thyroid disease. We'll explore what thyroid disease is, its symptoms, and how it can be managed effectively. Please join me in welcoming Dr. Ken Hupart to the show. Thank you so much, and I know you've been on before, so I'm just thrilled that you were willing to come back.
Well, this is second, but third's going to be the charm, right?
Oh, I hope so. So tell us a little bit about yourself, your training, your background, where you're from, whatever you'd like us to know.
I grew up in Brooklyn, like you. I went to medical school, did my residency at Montefiore in the Bronx, and spent a couple of times other places. But it was really nice about a decade ago when I had an invitation to come back to Brooklyn, my home.
Well, we're so happy that you're here. So you've been at South Brooklyn for how long?
Just about my 10th anniversary right now.
Oh, that's great. So happy anniversary.
Thank you.
So tell us, you're an internist, right?
I trained in internal medicine, which is medicine for adults. Internal medicine is comprised of multiple specialties, and after I finished my internal medicine training, I then trained additionally in endocrinology and metabolism.
So endocrinology and metabolism, that involves what parts of the body?
Some specialties can tell you that, I'm a cardiologist, so I deal with the heart. Endocrinology and metabolism has more to deal with the chemistry and the hormones of the body. So we're really looking at how the body responds to messages that are going through the bloodstream and start in one area, travel through the blood, get to another area, and then they control processes. So last time we spoke about insulin traveling through the body and affecting the sugar. When that's a problem, we have patients with diabetes. Today we're talking about thyroid diseases. Again, the thyroid here in the neck is going to make thyroid hormone that travels through the bloodstream and affects just about every tissue in the body.
It's interesting you should talk about the cardiologist. I was thinking, I know where my heart is, but I'm not entirely sure where my thyroid is. So you said the thyroid is in the neck.
If you think about right here, right near your Adam's apple, there's a small structure, weighs about an ounce. It's the shape of a butterfly, and that's where the thyroid is. It's about an ounce in people who don't have an enlarged thyroid, which we call goiter, but it can get substantially larger than that in some circumstances. Most of the people who have thyroid problems have a problem, however, with how that thyroid is acting. Is it overacting or underacting, or is it getting enlarged, or is it developing a lump here or there?
So how do I know that my thyroid is working properly?
It's a very good question. If your thyroid is getting enlarged, that's a signal. If it's getting very enlarged, it can cause a problem where it affects your breathing or your ability to swallow, or even can change your voice. But most people with thyroid disease, and it's really a very, very common problem, it's not something that's going to cause the thyroid to be that large, or it's not going to be very obvious to anybody else, and it may not even be obvious to the person. When the thyroid's working too fast, you're going to have your metabolism revved up. Your body's going to make a tremendous amount of heat, and you will feel hot and sweaty. Sometimes patients who have an overactive thyroid are going to come in, and they're going to say, I'm sitting at home in a t-shirt, and everybody else, I'm opening up the window on a cold day, and everybody else is wearing fleece. And that's one of the problems. Their gastrointestinal system is working in overdrive. They mostly notice that by going to the bathroom and having a bowel movement several times a day, or even having diarrhea. They may get palpitations of their heart, or they don't feel palpitations at rest. They'll just walk a little bit, and their heart will just feel like they've just been doing exercise. They'll be sweaty, they'll be shaky, and those are signs of an overactive thyroid or hyperthyroidism. Underactive thyroid is even more difficult for people to pick up. They may feel cold, but lots of people feel cold. And as people get older, feeling cold is a common problem. they may feel a little bit constipated and not move their bowels as frequently as they did when they were younger. Well, that could be normal aging, but that can also be hypothyroidism. Same thing with cold or cracking or dry skin. And if that's not picked up, when people have these very, very common problems, they can end up getting effects that could really be, again, not picked up, but they may not be thinking so clearly, and it may affect the way that they do their daily living, and it's not going to be going so well for them. So sometimes people get told, you know, you're not right now. Something's changed in the last few months. Go see a doctor. But some people never realize it themselves.
This is incredible. This little tiny thing you said is in my neck could be normal. It could be working too hard, and I think you said that's hyperthyroidism, right? Or not working hard enough, hypothyroidism. So I could be too hot or too cold or perfectly fine. I could be, I guess, too skinny, too fat, depending on how fast the metabolism is.
So I want to actually mention that, because one of the common things when somebody's having a weight problem, either side, they're convinced it's their thyroid. When people are hyper, they may tend to lose weight, or more commonly, they stay about the same weight, but they eat anything they want in amounts that don't really matter, and they stay about the same. When people are having difficulty losing weight, very common in our culture right now, and everybody's looking for, you know, an underlying reason. People will say, oh, it's my thyroid, but the average weight gain that people may have is 5 or 10 pounds, not why they are now weighing 30 or 40 pounds more. But yes, it does control the way that we metabolize our energy, and people can gain weight or lose weight, just not to the degrees that most people are looking for.
So is this a disease that's common? Has it always been there, or is this something new?
It's always been there, and it's been there more. We'll talk about a bunch of different thyroid diseases, I'm sure, but about 1 out of every 6 Americans has some form of thyroid disease that they'll develop during their lifetime. So it's very, very common, and we can go over that. But it's that underactive thyroid. The most common cause of that's something called Hashimoto's disease. And Hashimoto's disease, depending upon how we say you have it or you don't have it, will probably affect, 15 to 20% of people in the United States. Women, 15 to 20%, men much less than that, and it averages down to something like 11 or 12% totally. And many of them feel fine. Their blood tests will show that their thyroid's working normally, but if you have Hashimoto's disease, over your lifetime you have a 1/3 to 1/2 chance of actually developing that underactive thyroid. But we can see it by blood tests.
That's a lot of people, and you can make the diagnosis on a blood test.
Sometimes you can make the diagnosis just by physical examination and a little bit of a history, and I would say the blood test is often confirming that which we may suspect. People get screened for thyroid problems all the time with blood tests, but I would say that the medical industry out there, which involves not just doctors, but laboratories and hospitals and insurance companies, haven't quite yet all signed on to getting screened for thyroid disease. Although there are many circumstances where I personally believe that people should be screened. If they have those symptoms that you and I were talking about before, if some people feel that they're forgetting things more, is it because of normal aging or not, or the beginning of a problem, or could it be reversible and from the thyroid? Is there a family history of thyroid disease? I think that all women who are pregnant should be screened for thyroid disease. We already screen all newborn children for the presence of thyroid disease. So we do look for it a lot, but if there's anything that pushes one to say that, yeah, my risk is a little bit higher, I think that we should do the blood test. It's not expensive, and it can be very, very helpful in terms of not having somebody develop terrible symptoms before they get diagnosed.
So that's interesting. You said we screen all newborns, and women during pregnancy get screened?
I would say that we definitely, in the United States, screen all newborns.
Women. Why is that? Is it just so common in babies?
There is a condition called congenital hypothyroidism. For millennia, it was a scourge. It was terrible. At the end of pregnancy, women would deliver a child. That child would have certain shapes of the head that were not exactly the way that one is looking for it, but more importantly, brain development did not proceed as it was supposed to. And even if you can catch up in the first few weeks or months, if it's not diagnosed and thyroid hormones not given, cognitive ability will never reach the level that it was supposed to reach. So this caused tremendous disability. It was now found that if we screen babies for the presence of this disease, and it happens in hospital deliveries all over. If the baby wasn't delivered in the hospital, this is arranged in all 50 states. And if we can find a hint of a thyroid problem, it will be followed by blood tests in days or a couple of weeks. And if we diagnose it and start thyroid hormone therapy, that child will grow up to be pretty normal. And that's an amazing thing. In the United States, it would happen perhaps 1,500 times a year that we would, be able to save somebody, but it's really saving a life.
So is the number of people, I guess, number of babies in the United States with this disease going down because we pick it up early and we treat it properly? Is this something that you treat in children, but then it pops up and starts becoming a problem in adulthood, or is it something curable?
It's a disease in almost all cases, that the child will have for the rest of their lives. They didn't form a thyroid normally when they were developing in the womb. So they will never have a thyroid that can be normal, but being treated with thyroid supplements, pill every day, or liquid in the first few years of life, will keep the person absolutely normal. There are some other much less common circumstances where a baby can be born who has hypothyroidism transiently. That could be because the mother has thyroid disease, and that thyroid disease, antibodies from the mother's blood went through the umbilical cord and the placenta and got into the baby. As those antibodies disappear, the baby may become normal again. The mother may have been taking some medication that was affecting the baby's thyroid. But that is the much, much less common cause. Mostly it's something that the child will have, but by taking that medication dose once a day, child will develop like everybody else.
Great. So let me see if I get this. Women during prenatal care should be screened, and if the thyroid is not normal, it's treatable. Babies are screened, and if the thyroid is not normal, it's treatable. Let's talk about adults. You said you can have an overactive thyroid or an underactive thyroid, but you also said there are the diagnosis you can make just on a blood test or even on a physical exam?
Well, on a physical exam, we can pick somebody up who has an enlarged thyroid, or we can pick somebody up who has a lump in their thyroid. Now, we don't see these goiters, these enlarged thyroids, the way that doctors of generations before us did. When you were talking about this very small little butterfly-sized gland in our neck controlling our whole metabolism, it's even more difficult to think about human engineering than just that little gland is controlling everything. That little gland depends on a source of iodine. We all need iodine to make our thyroid hormone. The way the world is right now from the ice ages is our oceans have a lot of iodine in them. Places that are near ocean and sea coasts have a lot of iodine in them. But there are many parts of the world where there are many large human populations and they don't have ready sources of iodine. It's not in their food chain very much. In the United States, that was actually around the Great Lakes. The Great Lakes do not have iodine in the water over there. It was in Appalachia, and it was in the northwestern states of the United States. And they used to call that, 120 years ago, the goiter belt. And from the work that was done, there was one doctor who was sort of amazing. His name was David Marine. And he was raised in Maryland, coastal. Didn't see much, goiter going around there. Went to school at Johns Hopkins and became a physician. And then he matched for his residency. He didn't have a match then, but he was offered a residency position in Cleveland. And he went to Cleveland, and as he was walking through the streets, as he arrived there, he was noticing all of these children and adults with large, large thyroids. He had not really seen that before. And story is then when he started noticing it and taking walks to look, he started noticing that the dogs in the street also had large thyroids. And he wanted to figure out what was going on. And there were publications for 100 years knowing that there was iodine in the thyroid gland. Some people saying that you can give iodine to people with thyroid diseases and it made them better. Others said it made them worse, so nothing really happened. He went to the Board of Education and the mayor in Cleveland and said, I want to give iodine to the school children. Right? They're developing these big thyroids, and I think that if we did a little trial, we may be able to do something. And Cleveland said, no way. But Akron said yes. And he had 2,000 children that he gave iodine to, and 2,000 children that didn't get any iodine. They all had thyroid exams, so some of them already had substantial goiters, right? Some didn't. And what he found out was that he could cause the goiters in some of the children who got the iodine to regress, and the development of new goiter, which was happening a lot in these middle school, mostly middle school age children, did not develop at all in the ones who were getting iodine. Very rapidly, we started seeing community after community picking up iodine supplementation. That's where our iodized salt now comes from. You can buy salt in the blue box or the red box, or the blue cylinder and the red cylinder, one of them being iodized, one of them not. It has a small amount of iodine in there, but that was enough to sort of raise the whole population in terms of the iodine that they were getting. In addition, packaged breads that you might buy in the supermarket, iodine was put in instead of bromine. They both equally affect the dough and sort of stabilize it and give it a nice consistency, but by putting this minuscule amount of iodine in there, the whole country became iodine sufficient, and these childhood iodine deficient goiters went away. It's a triumph of science in terms of noticing this and asking the question. It's a triumph of basically studying it, and instead of figuring out or making a guess, figuring out what the truth is. And iodine can prevent these goiters, and we don't really see them in the United States anymore. I'm not sure if you see iodine deficient goiters in your pediatric or adolescent practice.
I've seen one iodine deficient goiter in my entire life, and of course it was a teenager from another country. So clearly this is something that has been wonderful. But is there a negative of having iodine in our salt, for example, or in our breads? Can you get too much iodine?
Our body will lose excess iodine in the urine. However, you can end up with an underactive thyroid and a very large thyroid from not having enough iodine. However, in iodine sufficient populations, places where people are getting enough iodine, either naturally in their diet because they're here in New York and our foods here, when they're local, have lots of iodine in them, or because of supplementation, you may get a little more Hashimoto's disease and other autoimmune diseases. But on the whole, that's actually a better circumstance. One, the difference is small, and secondly, children are still developing, and to have them have impaired learning during the years when they're in school, et cetera, will obviously negatively affect their whole lives.
So why do we have salt without iodine?
Good question. One, now that we have a food industry and we all can, I don't know, supermarket last weekend, okay, it's pretty cold now. It's approaching Christmas time and New Year's time. I bought some blueberries in the supermarket this past weekend. So we obviously are getting food that is coming from all sorts of different places, and we're not dependent upon what's in the soil that's locally, that's within 50 or 100 miles of where we are right now. In the United States, some people are asking the question, do we have to now continue to take iodized salt? And I'm trying to remember, but I think in my childhood, you couldn't get non-iodized salt. Now it's out there. Some people don't want to take it, but probably the United States is sufficient or close to sufficient in most populations right now because of the food and because of the iodine that's in the bread. But it's something that I'm sure we'll be hearing a lot about as we examine evidence judging how we should approach public health problems.
Very, very interesting. I'm sure more to come. But I can't do a program on thyroid disease or any disease without talking about thyroid cancer. Is thyroid cancer something that people should worry about? Not a big deal? Is this something that is picked up easily? What can you tell us about cancer?
So thyroid cancer has been occurring more and more frequently. We're not sure if it's more frequent because we're diagnosing it more commonly with some of the tools that we have, or if there is a change that's going on right now. If you had to ask me which one it is, I'd say both. There are studies that suggest that the air pollution that we get exposed to may be associated with having thyroid cancer. There are also technologies that when I became a thyroid specialist and endocrinologist, we didn't have. I was of the first cohort of endocrinologists who actually got the sonogram into our hands, but now we have sonograms that are able to detect thyroid lumps that are really tiny, 1/4 of an inch, 1/2 an inch, and we know that there could be thyroid cancer in those, but the likelihood that you will find a thyroid cancer that will change a person's life, that will cause them to have a death because of that thyroid cancer, that will affect the quality of their life for some of these small, otherwise undetectable thyroid cancers, it's a minuscule likelihood. So we're all discussing and changing with time, when is a thyroid lump big enough that we should do something about it? Doctors, when they examine a neck, might pick up a thyroid lump. I've had a number of patients say, man comes in when I was shaving, I noticed a lump. I've had a woman come in who was putting on a dress to go to her daughter's wedding, and then her daughter was, putting on the collar and snapping the button in the back, and said, "Hey, Mom, what's that over there?" And found the lump over there. These were thyroid cancers that were picked up with lumps that pretty much anybody can feel. If you have a lump in your neck and it's not going away after a few days, you should bring that to a doctor's attention. The only way that the cancer, if it's there, will be able to be diagnosed, will be by doing a test where you put a needle in that lump and you take a look at it underneath the microscope. You don't take out a lot, you just put a very thin needle in and you move it up and down to take out a few cells. But that can be the way that we will diagnose the likelihood of having a cancer or not.
So
90 or 95% of those lumps won't be cancerous, though.
So people don't have to be screened for thyroid cancer like colonoscopy and prostate cancer. If you don't have a lump, should you be screened anyway?
So some people will say that, yes, the screening test is your doctor's fingers.
So it's just physical exam. You don't need a blood test.
It's examination. If you have thyroid cancer in the family, if you have another thyroid disease like underactive thyroid from Hashimoto's disease, if there's anything else that you had in your lifetime, if you had an exposure to radiation, those people need to be screened, and they need to be screened commonly. After the Fukushima disaster in Japan, after Chernobyl in the Soviet Union then, but Chernobyl's in Ukraine, the amount of thyroid cancer just shot up tremendously. Obviously, this doesn't affect large numbers of people, but the populations there were greatly affected, and it was really the children who got the largest relative doses, and the amount of thyroid cancer that they have is quite large.
Fascinating, fascinating. A small gland that certainly sounds like does an awful lot in the body. Thank you so much for teaching us everything we need to know about thyroid disease.
You're welcome.
That brings us to the end of our program today. Thank you for tuning in and learning alongside us. For more information about our show, visit www.zormed.com and stay updated with South Brooklyn Health by visiting us online. This broadcast was brought to you by Brick Media in partnership with New York City Health and Hospitals, South Brooklyn Health. Until next time, be safe and stay well.